Hello and welcome to the first episode of Season 2 of Health Mantra with me, Dr. Stacey Fernandez. In the studio with me is Dr. Sunny Kamat. He is an orthopedic spine surgeon at Manipal Hospitals, Goa. Dr. Sunny has done his MBBS at the Goa Medical College and MS in Gujarat and went on to do his fellowship in endoscopic spine surgery in Germany. Welcome to the show, Dr. Sunny.
Thank you, Dr. Stacey, for such a nice introduction.
Yeah. So, sir, they say a healthy spine is the foundation of a healthy life. So, with our daily activities of, desk job, sedentary life, long hours of driving and so many things that we put our spine through, what is the most common spine ailments that you see in your day-to-day practice?
That's a good question. Dr. Stacey, because of our changing lifestyle,
Right.
First of all, I'll make you understand that our spine is made up of bones. So the bones are stacked upon each other from top to bottom.
Yes.
Okay, and between these two bones, there are discs.
Right.
And there are nerves, and there are joints which is located behind the spine.
Right. So the nerves pass through the discs.
Yes. Yeah. So because of our bad lifestyle, there is a lot of damage which usually happens to the spine.
Right.
One thing is because of obesity. Secondly, because of continuously sitting for long hours, especially in IT individual.
Yes.
And unhealthy diet, smoking, alcohol. All
Even
these
wrong postures.
Correct. All this affect our spine. Because of that, we usually see disc-related or degenerative changes more frequently than what we used to see in past.
Right. So over and above this, a certain contribution of injuries also to the spine contributes to ailments in spine.
Yes, injury also contribute. For example, because of increasing traffic and lot of people going by bike and four-wheelers.
Right.
Our spine is usually prone for injury because of accidents.
Right.
And adventurous sports activity as well.
Yes, yes. So, doctor, medications is always the first line of treatment in anything. But what is the surgical approach in spine care?
Yeah. When it comes to spine surgery, the surgery is divided into two parts. One is open spine surgery, which is a traditional or a conventional way of operating spine, and the newer or the advanced technique what recently has arrived is endoscopic spine surgery.
Right. So, doctor, how is the endoscopic spine surgery different from the traditional spine surgery approach?
In traditional spine surgery, what we do is that we open the skin from behind, and the incision is usually long.
Right.
And after that, we split the muscles to expose the spine.
Right.
Without that, it's impossible to reach the spine. Okay. But in that process, what we do is that we do a lot of collateral damage to the very important structures like muscles, which is one of the important organ, you can say, to maintain the spine balance.
Yes.
Because of the stripping of the muscle from the bone, it loses its strength and nerve supply. We denervate it actually, and because of that, the strength of the muscle, the patient loses the strength in that muscle forever.
Forever.
And because of this, since we have to open the spine, there is a lot of blood loss.
Right.
Okay. So in most of the cases, because of the blood loss, we have to transfuse blood to the patient.
Yes.
Okay. And because of the longer incision, a lot of tissue trauma, the usually recovery of the patient is less. It is delayed. Okay, and because the recovery is delayed, the patient joining or resuming the duty is always delayed.
Right. So, doctor, which spine conditions would you recommend for endoscopy spine surgery?
As I told you, Dr. Stacey, the most common clinical condition in spine what we encounter is degenerative spine disease.
Right.
And disc prolapse. Now I'll explain you briefly what exactly these conditions are.
Yes.
So in degenerative spine disease usually happens because of the overloading or the unequal loading of the spine. And with the passing age, the disc and the joints around it gets damaged. So because once the disc gets damaged, the gel inside the disc, it comes out and it presses on the nerve. Once it presses on the nerve, patient can get sciatica kind of pain or the pain radiating from the back to the leg,
Right.
which also can be associated with the numbness or loss of strength,
Yes.
or difficulty in walking for long distance, difficulty in sitting for long hours. And in very rare, not rare, in most of the condition, if the joints are affected, that once the joints are affected, the spine becomes little unstable. Like there is a lot of instability in the spine, in which what happens, the joints become loose. Because of that, the spine slips, one vertebra slips upon
Over the
another
other.
one, and that is called listhesis or instability of the spine. Now this condition is very debilitating because it causes severe back pain, and usually medicine don't work in this situation. And there is other things like, usually because of trauma, youngsters usually they go to gym, or when they land up in injury or because of accident or other
Sports
adventurous
or, yeah.
activity, the excessive pressure on the disc can rupture the annular ligament or the outer covering of the disc, and because of that, the inside gel, it just pops out and it presses on the nerve. That can cause severe
Right.
back pain and acute disc prolapse.
Right. So, doctor, what are the benefits of endoscopic spine surgery?
The benefit of the endoscopic spine surgery is that this is the most advanced surgical technique available on spine surgery right now. The technique actually originally it originated in Germany, and most of the instruments are made in Germany. And that's why you need to start this kind of surgery. It is technically demanding, and for that you need to have a proper training.
Training,
Especially, preferred training is in Germany.
Right.
So what we do in this endoscopic surgery is that we can operate the same condition with a small incision which is less than 10 centimeter. Otherwise, if we do a conventional surgery, we usually have to open around 10 centimeter or more.
Right.
And we have to remove, sometimes we have to remove the midline structure to decompress, or the bones, which is right there in the midline in the conventional surgery, to
Yes.
enter or to approach the
Spine.
dural sac or the spine or the nerves. But हातून कितें जाता की within less than 1 centimeter, what we can do is that we introduce a endoscope which is very small, which is around 8 mm. Okay, and we introduce it, and with that we are able to visualize the entire spine on the monitor.
Right.
So in that, even a 1 mm or 2 mm object looks very big.
Very big.
So
Magnified.
all the images are magnified. Since the images are magnified, we are able to get a better visualization, and with better visualization, we can operate in a better way. It is just like you are driving, and if there is a lot of haziness, if you can't see from the windshield,
Right.
usually happens because of an open surgery. There's a
Yes.
lot of bleeding, very difficult
Yes.
to manage the
Manage
bleeding
the
sometimes. So in that, you are bound to make mistakes in open surgery because there is a lot of bleeding. You don't
Yes.
see the nerves properly sometimes. Okay, but in this case, everything is so magnified. You know what you are touching.
Exactly.
You know what you are doing.
Right.
Each and every step, it is magnified that you usually don't go wrong in this.
Right. So that also speaks about the safety point of view, as in, because whenever you recommend surgery to a patient, they are always reluctant to undergo surgery. They will choose the other options first, and then the last option will be surgery. So how safe is endoscopic spine surgery?
So, see, there is a lot of misconception about the spine surgery in general public. So they feel that if you do a spine surgery, patient will never be able to walk, patient will get paralyzed, or usually the spine surgery fails, or the patient has to take long bed rest for months altogether. So all these misconceptions are, it's not right, So in today's era, see, the medical science has progressed.
Right.
Okay, from what it was 30, 40 years back, it is not the same now.
Yes.
30 years back, 40 years back, we used to use landline.
Right.
Now we
Now
used to
we have
send
5G.
letters. Yeah, now we have 5G, and so on. So
Yes.
as the time moves, the technology also improves.
Right.
It becomes better and better. Along with that, the training of the doctors have also improved. The
Yes.
instrumentation has improved. The understanding of our spine and its pathology has improved because of the lot of research which is going on.
Yes.
So in this era, spine surgery is absolutely safe. Now if you ask me, the most commonest question the patient asks me, whether you will get paralyzed after the surgery.
Yeah,
So I would assure you, and in today's era, the paralysis is almost zero, negligible. So you have to follow certain things.
Right.
You have to choose the right patient, right indication,
Right.
right technique, the right doctor, and the right instrumentation.
Yes.
So if you do this thing, if you match all together
the points.
properly, you cannot go wrong, and you will never end up in complication.
Right.
Okay, especially when it comes to paralysis or other complication. But yes, there is some complication which is there
Which
with
every
any other
surgery
surgery.
has. Yeah. Every
Yeah.
surgery
Every
has
surgery
a risk
has
to it.
some complication which is related to anesthesia, infection. That complication will never get nullified as long
Yes.
as surgeries are there.
Right.
Okay, so in today's era, the moral of the story is that the spine surgery is absolutely safe, and the safest right now is the endoscopic spine surgery. As I
Yes.
told you, it is done with a small incision. The view is magnified. You know what you are doing because everything is displayed on the screen.
Yes.
And there is almost negligible blood loss, so you don't have to transfuse blood to the patient.
Yes.
Since the incision is very small, there is hardly any infection.
Right.
Since the incision is small, there is no collateral damage or the
Of the
tissue to the
musculature.
muscles.
Yes.
Okay, and the recovery
Is
is
faster.
faster.
Right.
So in endoscopic spine surgery, you can resume your duties as soon as possible. So what we do, can make the patient walk on the same day.
Okay.
Patient don't have to take bed rest for several months.
Yes.
And sutures can be removed. Once the sutures are removed, patient can get back to
his work.
Yeah.
So, doctor, what is the length of the surgery in endoscopic surgery? Is it different from the traditional spine surgery?
Yes,
The length of time. I meant to
correct.
say.
In traditional spine surgery, see, right from the incision to going to the spine, it takes a lot of time.
Yeah.
So to split the muscle, to do proper hemostasis, or to stop the bleeding.
Yes.
That time gets shortened up when it comes to endoscopic surgery. So the endoscopic surgery will range from anywhere from half an hour to 1 hour.
Yeah.
Most of the time, 90% of the time.
Okay. Which is much less than the traditional surgery.
Yes.
Time.
Traditional surgery can go for 2 hours or more than that.
Right.
Sometimes.
So you save on your surgery OT
Surgical
time also.
anesthesia time.
Anesthesia time. Right. Doctor, is there any restrictions with regards to age and gender when you recommend endoscopic spine surgery?
Yeah, of course, there is absolute indication for endoscopic spine surgery, because all spine condition cannot be treated with endoscopic spine surgery.
Right.
The commonest condition which can be treated with endoscopic spine surgery is disc prolapse and canal stenosis.
Right.
Okay. Now, disc prolapse is like slip disc. Okay, in which we go and remove the disc fragment directly.
Right.
Okay, and in lumbar canal stenosis, it usually happen in a little elder group of patient, in which there is lot of damage to the joints, as I told you, of the spine, and because of there is growth of flesh around the nerves,
Which causes the pain.
compression of the nerve, and which can cause back pain and the leg pain. In these are the main indication of the endoscopic spine surgery.
Right.
There are certain conditions like instability. Whenever there is when one bone slips on another bone, that is called instability or listhesis. Those conditions usually we don't operate with endoscopic spines, because that condition first thing you'll have to you have to prevent the instability. In that, the treatment option is totally different. So I will not discuss that.
Yes, yes,
Yeah.
definitely.
And definitely the other condition like tumor, infection, those cannot be treated with endoscopic surgery.
Right.
So this accounts to like 70 to 80% of the actual spine conditions.
So doctor, that what we discussed now is about the surgical part. Now we'll go on to recovery phase. What would you like to highlight in the recovery phase with regards to endoscopic spine surgery versus your traditional spine surgery?
So the biggest advantage of the endoscopic spine surgery is that the recovery. See, in today's era, no one wants to stay at home
For more than what is needed.
Yeah, more than what is needed, or because everyone is working and tired.
Right.
Sometimes a person's family is dependent on them, and you can't afford to stay home, or you can't afford to be bedridden or join duty in which you will have constant back pain and other things.
Yes, and where you'll have to stay back
home. Exactly. So the recovery of after the endoscopic spine surgery is very rapid, because the incision is less than 1 centimeter. It just imagine you can just put the bandage. You can bandage that wound with the with the bandage what we used to. So that small the incision is.
Right.
And there is no bleeding, no muscle trauma. Since the muscle trauma is almost negligible, you will not have back pain.
Yes.
Okay, and that whatever pain you have usually settles down in 1 or 2 days. Okay, and because of this all this condition and all these advantages, patient can actually resume back his duty within 2 or 3 weeks.
Yeah, so duty as in not only work but also daily activities whatever they are used to do.
For example, driving, riding, and going to office.
Yes.
Yeah, there are certain things you used to you should be avoided,
which they can do gradually.
Gradually, yes. Correct.
Right. So Dr. Sani, which are the conditions that the patient should go for spine surgery, whether it is traditional or endoscopic, and is there an option where they can skip surgery and treat conservatively?
Yes. See, as I told you, most of the time, a simple spinal problem will respond to medicine and physiotherapy.
Yes.
Okay. So, most of the time, what we do is that we manage the patient without surgery, and they respond to it. But there are certain conditions in which the patient don't respond to medicine, physiotherapy, or injections.
Right.
Okay. For example, pain which is continuous leg pain, which is more than 3 months, not responding to any medicine, not responding to physiotherapy, and severe pain. Pain associated with numbness or loss of strength or involvement of the bowel bladder. That means involvement of the urine and other things.
Stools, where you cannot control.
Correct. If the patient develop this, for example, involvement of the urine and bowel, in that condition, it is an emergency. Patient, it is ideally not suggested or advised to wait. You have to get operated as soon as possible. That means the condition is much more bigger, something called as cauda equina. You can also become paralyzed, and that paralysis can be permanent. It cannot be reversible if you delay it.
Right.
So in this situation, you have to undergo surgery. And all this condition can be treated with endoscopic as well as open surgery. Okay, but it's advisable not to. Secondly, if the patient develop loss of strength or foot drop, it is not advisable, because
those are extreme conditions.
Correct. If the patient delays it, then there may not be recovery even after the surgery.
Right.
Okay, and yes, if the pain is so severe, the patient it is really affecting the quality of the life.
Right.
In that situation, patient should undergo surgery, because when options are available, there is no point in
just delaying
and
and procrastinating
or to prolong the suffering for no reasons. When you have options, you should explore that options.
Yes. Dr. Sani, I have a very interesting question. We discussed about lifestyle causes of spine ailments, but what about birth defects, congenital anomalies, Are those conditions also operated under endoscopic spine surgery?
No, mostly the birth defects or the congenital are not operated by endoscopic surgery. As I told you, endoscopic surgery has a very specific indication,
Right.
and you have to follow that indication. All procedure cannot be covered under
Under
endoscopy.
endoscopy. So, doctor, we spoke about the ailments that happen because of our lifestyle changes and the treatment with regards to surgery. But surgery is the last resort. What would be your advice to viewers as to take care of their spine? As in, what they need to do on a daily basis to prevent spinal injury so that they, don't get to that place of undergoing surgery.
Yes, that's very important question, Dr. Stacy, and I would say prevention is better than cure.
Yes, absolutely.
So I would advise my viewers, especially who are in tech business or who sit for long hours on computers or desktop, and it is very important to have a good posture. So
Right.
always invest in a chair with a good back support, with a good neck support. See that your computer or the laptop screen is always at the eye level, and the distance between your chair and the desk is sufficient so that you don't slouch over the desk. And if you do like slouching over a long time, you will definitely for sure have back pains. Secondly, you see that your elbows is closer to your body, your wrist is well supported on the desk, and you have to take breaks every half an hour, 45 minutes. You take breaks, go for a walk, stretch, and come back and start again. And obviously, people who go to gym, there's a new trend of strength training. You have to
Yes.
do strength training. I totally, I agree with that.
Right.
But I feel if you are not a professional athlete,
Right.
and if you are not going in any competition or you are not competing for anything, it is better not to do lift heavy weights, especially deadlifts.
Right.
So deadlifts, I feel, is only for the people who are athlete and who's been doing since long time.
And who go into
One day
professional
you just
weight
wake up
training.
and you cannot decide today I'll go and do a deadlift. It is very
Yes.
difficult because none
The
of the
posture,
trainers in the
everything
gym
matters.
will tell you. They will they won't, no one will tell you this, and secondly they will not stop you from doing this.
Right.
So you have to judge like how much it is going to benefit you.
Right.
I've seen so many of my patients coming to with a back pain and leg pain and sciatica pain, and the most commonest history is doing deadlift and lifting something heavy,
Right.
or usually they go to gym, then they take break and suddenly they resume it and they come with the back pain.
Yeah.
So if you're taking a long break or even a small break from the gym, when you restart it, you make sure that you start with gradual weight, then gradually increase the weight. Okay,
Right.
so
Small
not
steps.
necessary that what you were doing 6 months back, you will do
Should
it now.
immediately.
Yeah. So uh, lifting unnecessary heavy weights in the gym should be avoided.
Yeah. And not only at the gym, I think even in daily life.
In daily life, yes. How you lift the weight is
Is
also
important,
important.
right.
So if you bend and lift anything heavy, definitely it will
You put a weight on your spine.
you will strain your back. And in that situation, what you used to do is that you should keep your back straight and bend
Bend
on
your
your
knees.
knees and put the entire weight on your thighs and then lift anything,
Right.
any object. So, and one more important thing is that what we discussed, like lifestyle, smoking is directly connected to the back problems
Right.
and to a certain extent alcohol. Okay, so if you are a chronic smoker and you're having a back problem, and if you don't leave smoking, you'll continue to have that kind of problem, no
Problems.
matter how many
What you
doctors
do.
you meet or how many medicine you take.
Yeah.
So you should stop smoking. Smoking is absolutely bad for the spine.
Right. Even obesity, I think, doctor, that also puts a certain
Yes,
amount
of
of
course.
strain on your
Yes,
spine.
yes. Obesity, yes, because because of obesity, definitely you gain weight and you put a
So
lot
your
of strain
center
on
of
your spine.
gravity
Yes,
moves.
and you should also make sure that you do some strengthening of your core muscle, back
muscles.
muscle,
Right.
thigh muscle. Stretching, yoga is important. Daily walking is the best exercise for your spine.
Yes.
You don't even have to jog. You just have to do
Just walk,
walking,
brisk walking.
brisk walking for half an hour, 45 minutes in a day. That's very healthy for the spine.
Right, doctor. I
And
think
eating right balanced diet.
Balanced diet. I think what you said with regards to weightlifting, I think the same holds true even for yoga. I mean, a lot of us just want to do all the asanas, you know, at one time only, without proper training, without properly understanding each posture.
Correct,
So that
correct.
also could put a
Yes.
strain on your spine.
You should customize your all activities. Whatever suits you may not suit somebody
else. Right.
So you should do what suits you.
Yes.
So, you know, just because someone is doing some asana or someone is, running
because
a marathon, that doesn't mean that you can do the same thing. Yes, you can do it, but it's always good to gauge your ability and move towards your goal slowly and gradually.
Right. Doctor, thank you so much, you know, for taking time out and giving our viewers such an elaborate understanding about the spine and the various modalities of treatment. Dr. Sunny Kamat is the orthopedic spine surgeon at Manipal Hospitals, Goa, and if you need to seek help for spine care, Dr. Sunny Kamat is available at Manipal Hospitals, Goa, every day from Monday to Saturday, 9:30 to 4:30 p.m. Keep watching Prudent, stay fit, stay healthy.